demonstrate the median nerve sensory recording to the third finger. We will use 7-14 method. It's a very useful method to investigate carpal tunnel syndrome. The ring electrodes are put around the third finger. The active recording electrode, or the black one, is put over here. And at the more distal side, at 3-5 centimeters, we put the reference red electrode. We will stimulate at 7 and 14 centimeters proximal to the recording electrodes. That's why this investigation is titled the 7-14 method. I use an electrical stimulator. I made the felt pads wet, and we will stimulate and start over here at a stimulus intensity of 10 milliamperes. The sensitivity is 20 microvolts per division, and the sweep duration is 1 millisecond per division. The impedance is very good, so I can start a slow, repetitive stimulation. I just move a little bit to see where I get the best response. So here I have a nice response. The snap is immediately averaged over a couple of measurements. When I'm sure about the stable response and it is enough averaged, I stop the stimulation. This is my response of the sensory nerve action potential at 7 centimeters in the palm to digit 3. I press on next to get a proximal stimulation at 14 centimeters. Over here, next to the tendon of the palmaris longus, where there is the median nerve, and I will stimulate the median nerve at the same intensity of 10 to 14 milliamperes. We will start a slowly repetitive stimulation. Again, the stimulation is averaging itself at the frequency that we set up at the beginning of the examination. I have a very nice answer, and immediately the triggers are put on the same right position as before around the negative deflection. So for the 7-14 method, we are evaluating the peak latency at 7, which is 2.0, the peak latency at the wrist, which is 4.2, and we are calculating the difference in between the onset or the peak latency of both stimulations. We are also evaluating the amplitude. Based on these results, we can conclude whether there is a carpal tunnel syndrome or not.